right, I'm going to start, and hopefully if a few people join and you missed the beginning, feel free to listen to the recording, which we'll be doing. For all those who are interested, closed captioning in English is available for this webinar. If you'd like to see the captioning and are not familiar with how to turn it on, please see the link posted in the chat, which our associate's going to be putting there. So that should help. Also, if you have any questions during the webinar, feel free to add them into the Q&A or into the chat. We'll have people taking a look at those, and we'll get to some questions and answers at the end of the webinar. My name is Dan Beck. I'm the Communications Director at Tele-Transition, and we're really excited to present today's webinar. It's part of the CARES Act telehealth project from Family Voices. We're calling it Improving Healthcare Transition through Tele-Transition Services. So this is between us, Tele-Transition, Family Voices, and CT KASA with PATH, CT. And we're really excited to have so many people on. And as we said, for all those who aren't able to join, please pass it on that this will be recorded and put up on the Family Voices website. So for today's objectives for the presentation, we'll be going through basically three things. Lisa Ware with Family Voices is going to provide an overview of the Family Voices telehealth initiative funded by the CARES Act. Then we at Tele-Transition will give a little background on our recent joint telehealth visit toolkit and what it entails, how it was created, and what's its intended uses. And finally, some of our young adult advisors from PATH CT KASA will be unveiling our new exciting animated video and social story, helping young adults learn how to use that joint telehealth visit in their healthcare transition. After that, we'll open it up for some questions. We have some of our Tele-Transition associates on the call to help with that portion of the call. And then obviously CT KASA would be happy to talk about that video process. So I'm going to pass it over to Lisa Ware. She's the Associate Director of Programs and Strategy at Family Voices to get a little overview on their CARES Act. Lisa.
Thank you, Dan. So first of all, I just want to state that this webinar, as well as our entire CARES Act grant, was done with the support of HRSA, of the U.S. Department of Health and Human Services as part of an award totaling $1 million. And so we just want to thank our funders for this opportunity to bring this information to you. Next slide, please. So we, at the height, kind of towards the beginning, but more the height of the pandemic, we were approached by HRSA to engage in a telehealth project to really make sure that we could help families increase their access to telehealth services, as well as the ability for the F2Fs to be able to support families' ability to engage in telehealth services. And so with that, we received the funding that I just mentioned, and we launched it with a needs assessment. We wanted to understand, what do families need? What was the starting point? What information did they want? How did they want it delivered to them? And also, what were the needs of the F2F as they had to pivot from a predominantly in-person way of delivering services to really also utilizing telehealth, sharing health information through electronic mechanisms with the families that they serve. And so we engaged in a needs assessment. We did a survey of families, we did a survey of F2Fs, and we also convened a group of cultural liaisons from across the country to say, what are you hearing? What do you need? What are your concerns? What are the barriers that you have to engaging in telehealth services? And so from that information, we actually developed a four-pronged approach, which was our Telehealth Academy, which really served to educate and empower the F2Fs to be able to serve families. Curriculum development. So we developed an entire curriculum that's available on our website, and you're going to learn about one piece of that curriculum today. And so that curriculum included webinars, pre-recorded webinars, PowerPoints that are customizable, barrier busters, et cetera, in order to be able to really help families understand what can I expect and what do I need to experience a family-centered telehealth visit. So then we also engaged telehealth partners in our work. And so we partnered with 16 partners to help disseminate our materials and educate families about telehealth. And finally, our community of practice. And so we took a regionalized approach and we worked with states within each of the regions, and we brought together F2Fs, Title V agencies, AAP chapters, et cetera, to say, what are the barriers that you're seeing? What are the strategies that you're using? And what are the resources that you have for telehealth so that we could better help to build a compendium of resources and information and knowledge to help other providers and communities, organizations, families, et cetera, to be able to better access telehealth. Next slide, please. And so with that, this is just another piece. In order to do that, we provided mini grants as well to the F2Fs in order for them to be able to engage in their states. And we saw F2Fs do all kinds of things like partner with their federally qualified health centers. We saw them buy equipment for families, such things as minutes for phones and tablets. They partnered with lending libraries in their states in order to be able to facilitate getting devices to families to be able to participate in telehealth services. So the mini grants were used in multiple ways, and that went out to 56 of the 59 F2Fs that we have across the country. Again, we engaged in those communities of practice, the Telehealth Academy, and we built out that curriculum. Next slide, please. And so one of the gaps that we had was we really were lacking on adolescents. How can telehealth be used? And so through existing partnerships with Transition, we engaged in this particular component of the project. And so Dan is actually going to share more about the Transition Telehealth Toolkit and all about the work that Transition and CT KASA have done for this project.
Thank you so much. That's a great background on the project. So Transition obviously is mainly focused on how do we help young adults, youth and young adults transition from a pediatric model of care to an adult model of care. And with our increasingly telehealth-based world, we recognized how vital and important a telehealth visit could be to smoothing that transition. This idea for a joint telehealth toolkit originated during a focus group with some young adults who said that having that joint telehealth visit between them, their pediatric provider and adult provider, really made them feel more confident and comfortable with transitioning to adult care. So we developed a toolkit with the Children's Hospital of Philadelphia. CHOP, all of their clinicians, young adults, nurses reviewed it. Transition as a youth and young adult advisory group who reviewed it, as well as our family transition advisory group. So it went through quite a few levels of review. And the final product is something that I think really resonates with a lot of people around the country. Slide. So what is a joint telehealth visit? In a nutshell, it's a telehealth meet and greet between your pediatric provider and a future adult provider in which you and potentially your parent or caregiver is present. It's a great way to ensure this warm handoff to adult care from pediatric to the adult clinician. And it's a great way for a young adult to meet a new adult clinician. So the toolkit that we created has two portions. One of them is more directed for the providers. It has some sample content for what that visit would look like. And then the other portion, which would be great for youth and young adults and their families to look over, is background information on what they can expect, who would be present, some questions that they could potentially ask, and what kind of is the purpose of this joint telehealth visit. So the link there is for the toolkit. It's available on our site. We could put it in the chat. It's also going to be available on the Family Voices page, along with the video and social story we'll be talking about. But it's a great tool for all of you to look for, to see if this is something that your families, your young adults could benefit from. Next slide. So we understood that it's great to have a toolkit, but when we met with Family Voices, it'd be even better to be able to take the ideas and concepts of that toolkit and really make it relatable to youth and young adults. And the idea for a video came about. So we gathered a group of CT KASA members, a few of whom you'll be hearing from in just a few minutes, to discuss their experiences with transition, to talk about telehealth, and to marry the two, to discuss about how could we combine these two in a joint telehealth visit. They were really excited about the idea. We went over the past videos that Family Voices and CT KASA created specifically about telehealth itself. And then we also went over our joint telehealth toolkit. So it was a great meeting in which our young adults really gave us some great ideas for creating a script and creating this animated video. So it really is a video that was created by youth and for youth to help them think through how this this joint telehealth visit could work. Slide. So I wanted to introduce Emily Cohen and Victoria Nuss. They're two of our young adult advisors from CT KASA. They were helpful with, like I said, that meeting, and then for creating the animated video and the social story related to the joint telehealth visit. So I'm going to turn that over to them. They're going to talk about their experience with creating the video, and then we're going to actually get to watch the video after they give us some background information.
Hi, my name is Emily Cowan. I'm the youth coordinator for CT KASA. I have been a member since 2014.
Oh, hi, I'm Victoria Nuss, and I'm the board of representative on PATH.
Some of the other CT KASA members who participated in the project are Emily Cowan, Stephanie Lubago, Caitlin Ramos, Sammy Nuss, and Ariel Powell. Victoria, do you want to walk us through what happened here?
Yeah, so, hold on, I'm trying to, okay, there we go. So, for the video, CT KASA of Transition and Family Voices had a meeting to discuss the creation of the animation video. At our meeting, all our CT KASA members talked about the importance of HCT and telehealth. We talked a lot about advocating for ourselves and how useful telehealth can be for young people with disabilities. We hope this fun video will help young adults use a joint telehealth visit as they transfer to adult care. And how we made the social story, CT KASA used themes from the animated video, and our ideas were placed into the social story template. All youth members reviewed and approved the documents. Like the video, we hope this social story will help improve the transition for young adults by encouraging the use of joint telehealth visit.
Emily, would you like to speak about the social story?
Yeah. Yeah. Who is government to adult health care?
Perfect.
That's, yes. Yeah, I just wanted to, she had explained how, this is Carmina, I'm sorry. She had explained how they created the social story to help those individuals that are visually, a lot of people are very visual, to help them go through the process of transitioning to adult healthcare.
Yeah.
This is Dan. I think one thing also that the young adults really hammered down was how important these meetings can be about young adults advocating for themselves. And I think you'll see that in the video that, you know, that this joint telehealth visit is all about them, and for them to really dictate what they want to say and how they want to say it and who they want to be there is really important. So the idea of communication was something that we heard loud and clear from God Transition's point of view throughout the video creation process.
Healthcare transition, or HCT, is about moving to an adult model of care where you are the main person making decisions about your health. For many youth and young adults, this can be a challenging process. HCT is not a single event. It's a process that usually takes several years to accomplish. One major part of HCT is learning to manage your own health and healthcare. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Turning 18 also means your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential, but you can decide if you want your parents to see your records or be in the doctor's appointment with you. In our new virtual world full of telehealth doctor appointments, how can we make the transition to adult healthcare smoother? Having a joint telehealth visit could be a good place to start, especially if you have a chronic condition. This is a virtual meet and greet appointment that can help prepare you for your transition to a new adult doctor. Let's walk through how a joint telehealth visit might work. A joint telehealth visit includes you, your pediatrician, and new adult doctor, as well as your parent or caregiver if you wish. During the joint telehealth visit, your pediatric doctor will introduce you to your new doctor. Your pediatric doctor will also share some important medical information about you with your new adult doctor. The visit is a chance for you to meet with your new doctor before you go to your first medical appointment. During the joint telehealth visit, you can also ask your new doctor questions about concerns you have. It can be a good idea to prep some questions beforehand. So here are some examples of questions you may ask.
How do I get to your office? What should I bring? Is your office accessible? Do you have my up-to-date medical summary? How do I schedule an appointment? How do I reach you if I have questions or a health emergency? Can my caregiver join for some or all of this telehealth visit? What forms do you need so you can communicate with my caregiver? The joint telehealth visit can also be a great opportunity for your new adult doctor to start to get to know you. Feel free to share some fun or important information about yourself that you want your new doctor to know before your first visit with them. Here are some examples that you could share with your new doctor. Something you enjoy, like sports or drawing. Something about your medical history. Something about your preferred communication style and capabilities. Something you are worried about at the new office, like blood tests. Who else would you like to be involved in your healthcare, such as your parents/caregivers? After this joint telehealth visit, work with your new adult doctor's office to set up your first appointment with your new adult doctor. So why is the joint telehealth visit a helpful part of your transition to an adult doctor? A joint telehealth visit is a chance to get to know your new doctor, ask questions about their office and how it works, build trust with your new adult doctor, share your story, self-advocate for your health needs.
Healthcare transition is all about taking charge of your health and feeling empowered. So go for it. Speak up during your doctor's appointments, and if you need your parent or caregiver's help, ask them. It is important to feel comfortable during this process. And when you advocate for yourself, the transition to adult care will make the change easier and an overall better experience. Got Transition is a program of the National Alliance to Advance Adolescent Health and is funded through a cooperative agreement from the Federal Maternal and Child Health Bureau, Health Resources and Services Administration. This program is supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services, HHS, as part of an award totaling $1 million with 0% financed with non-governmental sources. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government. For more information, please visit HRSA.gov.
So this is just one video, as Elisa mentioned before, in several other projects that they've worked on. And I was wondering if Elisa wanted to mention some of the other videos that you can see and how to get to those. So
absolutely. Thank you, Dan. So as I stated, we developed an entire curriculum and website of information and materials and resources. And so CT KASA worked with us on a couple of other videos and social story sets as well. And so we have Understanding Telehealth, which really helps dispel a lot of the myths about telehealth, helps youth understand what can they expect in a telehealth visit, how can they navigate it. And the other piece that really came out of our work with CT KASA, as well as YASA, which is a Family Voices youth group, was there was a need, especially within the pandemic, to really focus on mental health. And I'm sure that many of the attendees here understand that the mental health impact that COVID had on youth in particular. And so it was really driven by them to also really have a document that focused on how do you care for your mental health within an emergent situation like the COVID-19 pandemic. And so there's a video as well as a social story that talks about how youth can be attentive to their mental health through self-care, et cetera. So all of those are available on our youth page on Family Voices website, and the links are here. And so this telehealth for transition services rounds out that curriculum for youth to be able to understand how telehealth can really enhance their health. Next slide, please. So as I just said, that all of our youth deliverables and all of our other telehealth content are available on the Family Voices telehealth website. So you can find it at familyvoices.org/telehealth. And then we have a specific youth page that Ian has just put in the chat for you. And there's also a QR code there that you can go straight to our youth page so that you can download these resources and materials for youth and families that you work with. So it's important, you know, I think telehealth is here to stay, first of all. I certainly hope so. We see legislation being moved and all of those pieces. And so we continue to share out information on our social media. So you can follow us about, you know, transition, as well as how to incorporate the joint telehealth visit into really your transition of care for adults, young adults that you work with, or young adults that may be on this presentation. And so, like I said, you can follow us on social media to get further information on that. So I'll turn it back over to Dan. Yep.
That was perfect. We wanted to give some time to open up some questions. If you wanted to put them in the chat or in the Q&A, it can be directed to anybody, or you could direct it to one of the three organizations, to the CT KASA Young Adult Coordinators, to GATTransition, or to Family Voices. We also, on our call, on our panel here, we have a few of our colleagues here from GATTransition. Dr. Patience White is a doctor who has done these joint telehealth visits. So if people would be interested in hearing what the perspective of a provider would be for these joint telehealth visits, we can also have put patients on the spot here as well. But I open it up to the crowd to see if there are any questions for us about the process or a joint telehealth visit in general. I see a question.
Okay, go ahead, Dan.
Oh yeah, I see a question about payment. Are both a pediatrician and adult physician able to bill for the visit? Patience or Peggy, I don't know if you wanted to chime in on an answer for that.
Hi, great question. Currently, there's no code for doing a joint telehealth visit. With the Academy of Pediatrics, our team are working with them to imagine a proposal for a new joint telehealth visit. So currently there is not a CPT code. However, some providers and MCOs have been willing to work out some arrangement so that it can be done, but it's specific to the payer. Thanks.
I see a question. Some pediatricians in Connecticut will see patients until 21. Is it better to find one before 21? This is a care coordinator who would like help, that helps with this. So Peggy, your patients, I don't know if you wanted to chime in on an age range for the joint telehealth visit.
Yeah, I'd be happy to. It's a great question. The age when somebody decides to go to another provider, presuming this you're talking about going from a pediatric adult provider, should be sort of quite fluid. It depends on the young person and when they are feeling ready. But what you don't want to do is leave it to the last minute. You'd like to plan this process and talk about it so the young person can choose who they would like to see, and then plan something like a joint telehealth visit. So if pediatricians say you have to leave their practice by age 21, the idea here is to plan long before that, and perhaps leaving a little bit earlier than that in case there are any further questions. Of course, there's an opportunity for the adult clinician to call up and learn about you if they're unclear about some of the medical questions. So they can do that and consult back to the pediatrician as well. So thanks for that question.
I see a question, Jody, if you want to go back to gallery view and unshare your screen.
I am working on that.
Patients, there's a question, how do doctors feel about the concept of the joint telehealth visit? That is probably from both the pediatrician's point of view and an adult provider, but what's their perspective?
I think their perspective is they both feel it's a very important thing to happen, because everybody gets a chance to quickly ask some questions and get to know the young person. I've been on now 2 or 3 of these, and it's been wonderful. The pediatrician actually introduces the young person and their caregiver family, if they're on the call, to the adult provider, and everybody gets a chance to ask questions. I mean, everybody doesn't have to take the time to come all the way in and get together. You can do it right quickly on a joint telehealth visit, and people feel more comfortable. And often there are questions that are unresolved. Perhaps we had one wonderful telehealth visit where the caregiver said, we really wanted to have some behavioral health consultation, and they'd been working on it. And when they said that to the adult provider, said, whoa, we have somebody that can actually see you in our office. And so it was all arranged. So the first visit both was done. And that probably wouldn't have happened if we hadn't been all on the call together. And the caregiver had an ability to say what their question was and what they wanted to do. So I think everybody feels it's a very good use of their time and a way to get to know and trust each other, which I think is a very important piece of all of this. Thanks for the question.
Patience, in the Q&A, someone, Maureen asked, if the meet and greet doesn't go well, do you think pediatricians are willing to help set up other introductions?
I always think that your pediatrician is going to try and work to help you find the right clinician. I think what's hard here always is we have to be careful about first impressions. Perhaps you want to give people a little bit more of a chance, because first of all, everybody's very anxious. Think of, I don't know, a time when you were meeting somebody that you were anxious about, and you often will form quick opinions and try to leave those at abeyance and really think through, is this practice a place that would be good for me? And if you're worried, ask further questions. So of course, I think the pediatric provider would be happy to help you try to find somebody, but I don't want people to be quick and say, oh, this one's not going to work, that one's not going to work. Sort of think through and be sure you give everybody a chance. Just as you want the adult physician to give you a chance and get to know you, I think it's the same from the other way as well. Thanks for the question. I hope I answered it.
That's great. Anna asks, in terms of a logistical question, is it scheduled with the pediatrician and then the adult provider joins in as a guest, or do you schedule it through the adult clinic? How is it scheduled, these meetings?
Well, I think this is the one thing that we all have to think about. Scheduling appointments from anybody's point of view is complicated. So what would happen is likely you would say you'd be interested in this, speak to your pediatrician, and they would reach out to the adult provider and say, is there a time that works? And I know that from the work that we're doing in a DC pilot around this, that is the number one issue. But as the system gets used to this, this becomes something that people really are asking for, like having joint clinic visits, which happen in some places if it's reasonable. I think people would have a schedule waiting maybe once a month, but because the pediatrician and the adult practice have worked together. And if they have somebody that's ready to use that time, then they go ahead and do it. So hopefully it'll become easier. I think in the very early part of this, scheduling is going to be something that you got 3 people, you got to get together. We all know how hard it is to get 3 people together. So everybody has to be patient as you work out the scheduling of this.
There's a question about the timing of this meeting in terms of a transition. They were asking, do you suggest that the primary care physician is transitioned first or after the specialists? And would this joint meeting, happen after you stay on with the specialists, or should you do with the specialists first?
I think everybody thinks it's important to have a medical home, have somebody that really sees the whole picture. Many of the young people I see have multiple subspecialists. So it's important that they really connect in the adult system with a primary care provider. The primary care provider on the adult side is going to be seeing you for 50, 60 years, and they'll play a bigger role as we all, I'm sad to say, age. We all do age, and we have other things that happen. So connecting with a primary care physician, I think, is the most important. You certainly, if you have a main subspecialist, work out something with the primary care. I've seen actually the primary care and 2 subspecialists be on a call briefly. Now that's very complicated. That took a long time to coordinate. And as we said, the system hasn't caught up. We have no billing of this. So you're asking all these physicians to take this time. They're anxious to be helpful, but sometimes it's hard to do. So first of all, I would say go with transitioning your primary care first, and then think about transitioning your pediatric subspecialty care. Thanks.
Super helpful. Patients, there's a few questions about other professionals. Someone was curious if, if the doctor's busy, will the nurse managers at the clinics ever do these meetings on behalf of the PCP? And can other professionals bill for a telehealth visit, like a therapist or a social worker?
All right. So those are several questions in one. Yes, when we're working with Children's Hospital of Philadelphia, they actually have the nurse coordinator come on from the adult visit. So actually she comes on to these joint telehealth visits. Now she cannot bill, just like the provider cannot bill when you're doing a joint telehealth visit between a pediatric and adult practice. Now that's very different if we're talking about a sort of collaborative meeting between the school system of PT and OT and one provider. There are a lot of opportunity to bill for that because it's one provider actually billing for the service, and then you can have other people join in. So as I said, that's a 2-part question. One is about a joint telehealth visit, having somebody other than the physician coming into the practice. And the other is, can other people join a telehealth visit, not necessarily a joint telehealth visit? I hope I've clarified that. Thanks for the question.
Super helpful. There's a question here about, have you known if the pediatrician's office has issues with coordinating the joint meeting, like using their resources?
Well, I think that, I don't know the answer to that because the pediatricians have often wanted to actually schedule it. I mean, I think probably they feel like they're the responsible physician. They're really leading this joint telehealth visit. So I haven't seen that, but this is really new, everybody. We're talking about something that we're just starting to do. It's very exciting. After all, COVID just happened to us all. So joint telehealth is fairly new as well. So we all have to be patient as we work out all the kinks here. So thanks for the question.
There's a question about community-based programs. Could they be included if the family desires in one of these joint telehealth visits?
Well, I think, of course. I think obviously the young adult is the person that says yes or no about all of this. We have to remind ourselves they're the advocates for this process. But if they want a community-based organization to be on the call, of course, there's really no limit. It's just that the time becomes a limit. I mean, if you have 15 people on the call and everybody wants to talk, it may be a long call. So thinking about the purpose really here is to get to know people and have an opportunity to express your desires and needs and questions as a young adult, and equally the adult provider might have some questions. Now, of course, the providers on their own can connect. The purpose of the joint telehealth visit is really to have the young adult as a part of this. At any time, a pediatric provider can reach out to the adult provider to share issues or questions that are sort of medical based. And that's a separate issue. They don't necessarily have to have a telehealth visit for that. They can get on the phone or, they can do a variety of things, FaceTime for that matter. But I think that when we're talking about a joint telehealth visit, the real focus here is the young person, and they're advocating for what they want to know and tell people about themselves.
Yeah, there's a question here about, would it be recommended to provide the adult physician the patient's file beforehand so they can review it and be prepared with questions? I think that's a no-brainer.
Ideally, what you want is to have an information sheet about the adult office with some FAQs and questions answered about the adult provider that's been shared with the family. And then a medical summary that's been shared with the family and youth is also shared with the adult provider. So there's information going both ways here so everybody feels like they know exactly what some of the basic questions, like where's the office and so forth, you could ask. But ideally, if you had an information sheet from the adult provider's office or had been directed to their website and so forth, some of the questions could be answered quickly and you can move on to other ones that are important to you.
There's a question about when a child has a rare pediatric illness. This is more just general transition. When a child has a rare pediatric illness that is different than the adult version, have you seen adult providers hesitant to take those patients?
Boy, these are all great questions. You know, as a provider, of course, when I haven't ever seen a particular condition, and I want to obviously will learn a great deal from the family and the young person, they know most about this disease, but I would want to have some questions answered and some support from the pediatric providers. And often the models of transfer of care are very different according to the availability of the people that have the knowledge about that particular condition. So in that setting, it may be that the adult primary care provider does take on the care, but the young person still goes back to see that pediatric subspecialist until everybody's comfortable with some of the issues at hand. So there's a collaboration going on between the adult primary care provider who can really handle a lot of the young adult and adult issues. And they also collaborate with that pediatric subspecialist who knows the most about that very unusual chronic illness. So models change and everybody needs to sort of work together. And that's really a lot about what all of this is. Having open communication so people can figure out what works best for them.
This is all super helpful. For those on the webinar, Elisa has added some great tools from Transition. Thank you for that on our behalf. Included are an infographic for youth and families that just kind of goes over some great tools and information about transition. Transition also created on its own What is Healthcare Transition video recently. That's a quick little 3-minute video for you all, just a primer on transition. And then with Family Voices, Transition created a healthcare transition family toolkit. So it's got timeline, readiness assessment, all those types of tools to help people just in general to understand transition more. There was a question before about translating the video, this current telehealth video into Spanish. It's not currently done. That might be a project that we want to talk to Family Voices for future, but it's currently not in Spanish. So thank you for that. You'll also see our contact information that Jody's passed on. So if you don't get to any questions or if you think of something in the coming hours or days, weeks, feel free to email us. We're happy to reach out to you. This has been a really fruitful conversation. More than welcome to still add anything to the chat and Q&A. But we really appreciate the opportunity to talk about the joint telehealth visit and transition in general.
Well, I just want to thank on behalf of Family Voices, the amazing work that Transition and CT KASA and Path CT have done. The video, I couldn't have imagined anything better. And I think it definitely feels a need, as all of the questions indicate, about how can telehealth be used to really enhance the transition process. And so I just want to thank you for partnering with Family Voices on this important work. And I'm looking forward to continued collaboration. Definitely translating the video into Spanish is at the top of our list. So let's have some conversations. And like I said, I look forward to further work with you all. And thank everyone for attending today.
So if there aren't any further questions, again, you have our contact information, but we thank you all for joining, and I think this concludes our webinar.